Hello everyone, welcome to Diagnose It. Today we have this case and this is a kind of spot diagnosis for us, and this is a question asked like prolonged administration of which drug can cause these kind of skin changes. And we can see this is a kind of hyperpigmentation that has developed over the face of this female. And let me tell you the term used for this is called as ceruloderma. Now let's start our discussion. And firstly, let's discuss broadly over this hyperpigmentation part. Which drugs can cause this hyperpigmentation and why these drugs causes this hyperpigmentation? Well, this is the list of drugs that can cause hyperpigmentation. So firstly about this NSAIDs. Well, in the NSAIDs, this is more of a kind of fixed drug eruptions. So what happens is there is a single or sometimes few demarcated erythematous lesions that firstly develop, and after some time these lesions heal and they leaves a local brown or sometimes black colored pigmented area, and it can involve the face or it can also involve the extremities. Now about this Phenetoin. Well, in this Phenetoin it is kind of melasma. Melasma kind of rash develops over the face, and this is reversible and fades after 1 to 2 months. Now in this antimalarials, and in the antimalarials the drugs are basically the chloroquine and this hydroxychloroquine. And what kind of rash develop in these drugs? Basically in the starting a blue or grey colored rash develops over the face, neck and in the extremities also. But with time, with the prolonged exposure, this blue or grey colored rash then turns into a blue to black colored patches, and that are more on the sun exposed areas. They can also lead to deposition or sometimes discoloration of the nails and also of the retina. Now coming to this amiodarone, and this is a case of amiodarone induced ceruloderma. Now why in the amiodarone there is this rash develop, we'll discuss about it in detail. This rash, this is a blue to grey colored rash and occurs over the sun exposed area and more over the face. This is basically a reversible condition, and for resolution it may take around 1 to 2 years. Well, in the antipsychotics, the drug that is most commonly causing this hyperpigmentation is chloropromazine. And the chloropromazine, this also causes blue to grey pigmentation, and it also occurs in sun exposed areas. This can also cause pigmentation of the conjunctiva and can also lead to development of cataract in the patient. Now about these cytotoxic drugs, these are basically used for the treatment of cancer, and these drugs, basically this busulfan, cyclophosphamide, bleomycin, adriamycin, these drugs causes this hyperpigmentation. And the specific thing about this is this can also lead to discoloration of nails. Now about this tetracycline, and the most common drug, this minocycline. This can also cause this bluish pigmentation, and there is a specific thing about it. This most commonly occurs in scars. The depigmentation of the scar, it is specific side effect of this tetracycline, and it can also affect nails and the skin. It can also take years to resolve. Now about these heavy metals. The most common one used is firstly this iron. Iron can lead to dark brown pigmentation. This is called as sidrosis, and it is basically at the site of IM injection or sometimes this subcutaneous injection of the iron. Next one is about this gold. Gold salts were earlier used in the treatment of this rheumatoid arthritis, but now it is not that commonly used. But in the Ayurvedic preparations, yeah, these are used. So these gold salts, these can lead to golden brown pigmentation of the body. Now this silver. Silver can also cause hyperpigmentation, and this is called as argyria. And this is also basically a greyish kind of pigmentation. So this is in general about the hyperpigmentation caused by these drugs. Let's discuss about the mechanism. Why these drugs causes hyperpigmentation? There are some common mechanism for this. Like firstly about this heavy metals. What these heavy metals do, they basically irritate the blood vessels. And when they irritate the blood vessel, they lead to damage and they leak out. And when they leak out, they get deposited in the dermis. And when they get deposited, this leads to discoloration of the skin. So in this mechanism, melanin is normal. The next mechanism is some drugs can lead to formation of a drug pigment complex. And this complex basically formed in the sun exposed areas. Due to the sun rays, these drugs with the pigment form a complex, and this complex get deposited in the dermis, and this leads to this hyperpigmentation. In some drugs, they lead to this post-inflammatory kind of hyperpigmentation. And in the post-inflammatory kind, what happens is, due to this inflammation, some inflammatory mediators are released, and these mediators basically stimulate the melanin containing cells, these melanocytes, and this leads to increase in the amount of melanin, and this leads to hyperpigmentation. So these are the main mechanism by which a drug can cause hyperpigmentation. Now let's come to this case, this amiodarone induced hyperpigmentation. Why amiodarone causes this hyperpigmentation? Firstly, this causes slate gray to blue colored pigmentation. Okay, and the pigment that is deposited, this is melanin and lipofuscin. So these are the pigment that are deposited and the cause of this slate gray to blue pigmentation of the skin. Well, this pigmentation is reversible, but it may take around 1 to 2 years after the stoppage of drug. And the treatment for this is the stoppage of drug. And in case of if a patient cannot stop this amiodarone, then some less toxic alternatives of amiodarone can be tried. And the other treatments include this avoidance of sun exposure. Sometimes laser therapy can also be used in the treatment. So this is all about this hyperpigmentation caused by various drugs and this hyperpigmentation caused by this amiodarone specifically. If you have any questions regarding this ceruloderma, then you can post it in the comment section below, or you can DM me on my Instagram handle at diagnoseIt. So thank you.